Most of our work in Zambia is around eye health, and we're doing a lot of comprehensive eye health as well as NTDs. As Sightsavers, we've been supporting the Ministry of Health with undertaking most of the eye health activities in the districts where we've been working, in Southern Province, in the Northern Province, and in Eastern Province. So most of our work entails supporting them in terms of how they're doing service delivery. So we support them with human resource development. We support them with provision of consumables and equipment for surgeries. But we also provide resources for major outreach activities. Sightsavers' work is significant in contributing to universal health coverage in Zambia, because our eye health work is reaching a lot of women, is reaching children, and also reaching disabled people. This is important, actually, that when we reach more women, we know that we are providing them with a service, and we're also preventing blindness, meaning that they'll continue being productive, they'll continue taking care of the families. But also in children, I think this is important because we're also preventing childhood blindness. There are a number of instances where you have children who are not able to go to school, not because they are dull, but because the teachers do not understand them and they can't read. And when we provide these services, it's easy for the health workers to identify that a child just actually needs classes to be able to go back to school. And that's important for the child to actually progress. Women do not command a lot of authority over resources. And if a woman has to go to a clinic and she has to get on a bus or any form of transport, she might not prioritize using the little resources that she has to actually go get those services. And maybe the husband or the guardian, if it's a male, might not actually prioritize that for her. So by us taking the services very close means that we're actually capturing those women who might not otherwise get that service by actually seeking the services themselves, but also reaching the children in preventing childhood blindness, reaching elderly people, and also reaching disabled people. On our NTD work, we're doing, in Southern Province, we have a full safe strategy with funding from DFID. So we are undertaking surgeries, again, in Trichiasis, and we're also providing Zithromax through mass drug administration. Again, this is important because it's covering at least 80% of the population when we provide mass drug administration. And when we cover 80% of the population, we know that at least we're going to catch most of the women and the children who are the reservoirs of the TF in the community. So by reaching 80%, we know that at least definitely we are going to reach most of the women, because our community health workers, community health distributors are going to door. So if the women are not at a place where we're doing distribution, definitely they'll be provided with Zithromax through our door-to-door campaign. When someone develops trichiasis, their eyelashes turn inward, and the lashes start rubbing on the cornea. So if they don't have a corrective surgery, then that can lead to blindness. And of course, if that leads to blindness, we know that it affects their ability to be productive. And because most of the reservoir is in children below 9 years, and we know that most of the people that are looking after the children are the women, it's easy for the women to also get trachoma and also to develop trichiasis along the way. So this is important for us in terms of, at least when we're having a mass drug administration, to ensure that even when we're reaching 80%, we ask ourselves, of the 80%, what was the percentage of women and what was the percentage for children? Because our population is basically 51% women. So we try to ensure that at least we reach most of the women, most of the children, in order for us to actually ensure that we are taking care of the reservoir in the community, in the household.